Shall I start? Very nice. Yeah. Let's start, sir, because I think people are joining.
Yeah, already 64 out there.
Yeah. So, on behalf of VIP, I welcome all the participants to this on board to this important and very burning topic of modulating chicken immunity and health. Practically, if you consider today's situation of raw material prices and alternative raw materials are being suggested by the nutritionists, the farmers are in a trap. If you use alternative raw materials, it is going to impact the immunity and in turn the health of the birds. So to balance this, the VIP has taken up the first webinar of its kind for modulating nutrition and feed prices. So that was a wonderful webinar, and there was a good response to that. So nutrition and immunity, again, they go hand in hand, because many people are experimenting a lot of things, including using alternative raw materials than soya, than maize. So these experimentation they are doing, but at what cost? No. So it is very difficult to balance all these things, and for this we have organized this webinar, and which is very important considering the price. If you consider, if you compromise in the immunity and birds' health, if your FCR is down by 10 points almost, so with current price of 50 rupees almost, losing 5 rupees a kg. That is, your production cost will increase by 5 rupees a kg. So it's very difficult and important also to balance the nutrition and taking care of birds' health. And speakers today, the first one is Dr. Sudhir Rukadikar sir, and second is Dr. Prajapati sir. Both are quite excellent in their fields, and these are not both the speakers, they are not confined to the laboratory. Means pathology means lab. First you see lab, but it is not like that. Both the speakers, they work on the ground level, because they have the exposure of nutrition also, they have the exposure of postmortem also, and they have a rich experience of lab also. So let me introduce the first speaker, Dr. Sudhir Rukadikar sir. Dr. Sudhir Rukadikar sir graduated from Bombay Veterinary College, BBSc and AH. In the same college, he postgraduated in the year 1983. Worked as Veterinary College for about 3 years. He started career in poultry as poultry pathologist in May 1985. He served in VH Group for 13 years and left job as DGM. Served in Globion India Private Limited as assistant vice company also. So he knows how the titles behaves and how pathology accordingly changes. He working as freelancer. Presently, he is working as freelancer poultry health consultant for clients in India and other countries like Bangladesh, Nepal, Sri Lanka. Dr. Sudhir is a well-known poultry pathologist of India with more than 36 years of experience in poultry health field. He has a wide exposure to disease diagnostic laboratory procedures as well as feed operations. So he has worked from grassroots level in poultry farms. Dr. Rukadikar has also served as DGM Venkateswara and Private Limited, Globion India Private Limited, among various other positions throughout his widespread career. His clients are spread in India and abroad also. So I welcome Dr. Rukadikar to present his presentation, which will be very useful to the learners. So over to Dr. Rukadikar.
Thanks a lot, Dr. Ajay, for my fine introduction. I must express thanks from bottom of my heart for VIP Executive Committee for giving me an opportunity to speak at this august platform, because we all are vets, and it is not that when I speak here I am Guru or Mahaguru, nothing like that. We all know a bit of it, and we keep on sharing with each other. That is the beauty of this platform. So I think it's a really a good opportunity to share my thoughts with the audience today. So let me share my screen. Is my screen visible?
Yeah, Doctor. Yes, your screen is visible.
Okay, so thanks a lot. So I welcome all again on behalf of VIP, and let us go to our main topic, which is immunosuppression. As Dr. Ajay said in the beginning, this has become a main issue recently. Actually, it is there for so many years, but as the prices of feed raw material are skyrocketing, people are doing different experiments, and that is adding to this issue of immunosuppression. So let's try to understand the basic things and then see how it can be prevented, how it can be tackled with. As we know, the poultry meat and egg industry is being viewed as a provider of healthy alternate to red meat and other protein sources. As we know, there are other protein sources, veg and non-veg, but for red meat and this thing, poultry meat and eggs are being viewed as healthy alternate. And we know that poultry is the most efficient protein producing domestic species with lowest FCR. And that's why probably it commands the highest share of animal meat, animal protein consumed globally. That's the fact. Because we know that in the globe, practically all the animals are eaten. In Japan, they eat donkey as a delicacy. In Philippines, they eat rat as a delicacy. So all the animals are eaten. But poultry products, chicken, meat, and eggs, they command the highest share of animal protein consumed globally. But we know that we have a continuous threat of infectious diseases which are severely affecting our economics, and that's why it is always a hanging sword. So we know we are facing with all these problems like ND, IBD, Mycoplasma, and in some cases we know we have suffered from this the diseases which affect humans like human HPI or Salmonella or Campylobacter, all these things. So we must be very careful while giving the good product to our end consumer. Now we know that chickens have the inbuilt capacity, that is immunity to resist the diseases and adverse conditions. And we know that we can increase this immunity to a certain extent by various ways. But in certain conditions, certain circumstances, there is reduction in this resistance power of chicken, and this we term as immunosuppression. So it is a big threat to better poultry productivity of chicken because whenever the birds are not immunocompetent, they are immunosuppressed, we cannot expect the best productivity from these animals. We know that there has been tremendous genetic potential in these recent birds, be them layers or breeders or broilers. But if they are immunosuppressed, you cannot get a good performance from them. So it's a serious issue. And we know that there are two types of immunities we always speak of, cellular and humoral. So both or one of them may be suppressed because of immunosuppression. And it is not only chicken. It affects practically all the living species, maybe birds, cattle, sheep, goat, pig. In humans, we know that there are AIDS, acquired immunodeficiency syndrome, or severe acute respiratory syndrome, or Middle East respiratory syndrome. All these are indications of immunosuppression. It could be in plants also, I don't know, but since they are also living species, there could be immunosuppression in plants also. So it's a big issue, but we are trying to restrict ourselves to chicken immunosuppression. And if we see the age, it is generally more severe, but not restricted to young age. Nowadays, we are seeing immunosuppression in the fag end of their life cycle also. So we must take care of immunosuppression, prevention, and managing immunosuppression right from hatching till the birds are liquidated. So how to recognize immunosuppression in the flock, or what are the markers which will give us idea that our flock may be immunosuppressed? The first and foremost is poor growth. We know there are certain parameters of growth. We know, for example, if we are looking at the layer bird, by 4 weeks we expect 250 grams, by 8 week we expect 600 grams, 9 week, 12th week 900 grams, 16th week 1100 grams, and 18 weeks 1300 grams. For broilers, second week 700 grams, third week 900 grams, then fourth weekend 1500 grams. So all these things we know, but if the birds are immunosuppressed, then despite giving good feed or good breed, we will not get that growth. That is first indicator of immunosuppression. Then poor response or total failure of vaccination. This point I will cover again, but this is a very common finding nowadays that despite good vaccine being administered from a good manufacturing company with all the precautions, still it doesn't give the required immune response. If you check the titers, they are not as per our expectation. And same thing, even it may be utter failure of the vaccination and the flock may expect a frank outbreak of the disease despite vaccination. That is again indication of immunosuppression. Higher than natural mortality. Generally, we are not able to keep 100% flock live till the end of the production cycle. But there is a little mortality which is not very serious mortality in many cases. Like broilers, we expect around 3 to 4% mortality by liquidation age, or in layers, in growing, we expect around 2%, in laying, we expect over 6% mortality. But in immunosuppressed birds, even if there is no frank disease outbreak, we can get more than natural mortality. That is one more marker. Poor FCR, whether they are breeders or layers or broilers, the FCR may be very high. Nowadays, we expect the FCR of broilers to be less than 1.5, but here it may be much more than that. Or for egg layers, we expect the per egg feed FCR around 125 to 130. That may increase. In breeders also, we have the FCR per chick, per egg, hatching egg. So all these will increase if the birds are immunosuppressed. Increased rate of opportunistic infections like E. coli. We know that on their own, they cannot do anything. But whenever there is immunosuppression by any reason, they take upper hand and cause much damage than the immunosuppression itself. So overall poor performance is the finding whenever there is immunosuppression. So these we can take as markers of them. Now why this happens? Because there is damage to the cells or organs which are important in immunity development or immunity maintenance in the birds. So first two, they are primary lymphoid organs, bursa, fabriceus and thymus, we know. T cells and B cells, they are primary lymphoid organs. And in secondary lymphoid organs, we get spleen, bone marrow, lymphoid cell aggregates along gut, trachea and esophagus, Harderian gland, sickle tonsils and Peyer's patches. So BALT and CLT, bronchial associated lymphoid tissue and gut associated lymphoid tissue. And then the circulating lymphocytes themselves. All these are important in maintenance and development of immunity in the chicken. So these, one of them or many of them will be damaged in the immunosuppression, and that's why our chick is not able to have immunity as we expect from it. Now there are so many reasons which can lead to immunosuppression in our chicken. It could be infectious agents, maybe bacteria, viruses, fungi, protozoa, anything. Or then improper feeding balances, especially deficiencies of certain nutrients. Lack of biosecurity, very important point again. Managemental failures, putting stress on the birds. The stress and failure of biosecurity, these are most important factors of immunosuppression in the chicken, or a combination of them. So all these factors, either one or more together, will put a lot of stress on the immune system of the bird, and then we get immunosuppression. So I've divided this immunosuppression in two reasons, in two sectors, infectious and non-infectious. And in non-infectious, toxic and nutrition related and other things. So infectious, as we know, certain diseases, we are going to discuss them, viruses, bacteria, parasites causing certain diseases. Then in the non-infectious, it could be toxins, mycotoxins, microbial toxins, because when I say toxins, people will generally jump to feed toxicity. But it's not that. Microbial toxins are also playing important role nowadays. As we know, E. coli and Salmonella and Clostridia, they have their own toxins, endotoxins. So could be microbial toxins, mycotoxins, chemicals. Nowadays, we have to use so many chemicals for different purposes in our poultry operations. Those also could cause immunosuppression in the chicks, birds. Then drugs. Actually, drugs we have to use at certain points to save the birds. But drugs also are potentially toxic. We'll discuss it in the later slides. Then in other factors, it is nutritional deficiencies, I said, certain vitamins, amino acids and minerals. Then various physical and environmental stressors. Again, I say same thing. Stress is very important in the development of immunosuppression. And then failure of biosecurity. I put it in bold red because that's the point where we need to have more attention now. Of course, we have been speaking of immunity, biosecurity ever since 1992 when IBD struck India. But people are not very serious of it. Now humans also, we know in COVID epidemic, we have come to know what is importance of biosecurity, like washing of hands and sanitizing of hands and changing the clothes and taking bath when we return home. So all these things like biosecurity, they are still important in our poultry operations also. We know there are so many, about a dozen of points of entry of infective agents in our farms, like water, feed, litter, hatchery borne, stock from other sources, especially for those who purchase started pullets from others, vehicles, housing construction structure itself, which comes under structural biosecurity, workers, visitors, equipment, rodents, insects, wild birds. So there are so many portals of entry for our farm, and that's why our birds must be immune, because we cannot stop all this. Something of this will always be playing role in poultry operations. So we must try to minimize this entry plus improve our immunity of the birds so that they can fight these things. Among infectious factors, most important are viruses. Actually, these immunosuppressive viruses, they are frequently found as co-infection in the chicken industry, and they are potentially causing serious economic losses. So what are they? Generally, IBD, chicken anemia virus, Murray's disease, and fowlpox. These are main immunosuppressant viral diseases, which may appear as a clinical disease or still dangerous is a subclinical form, wherein we probably don't understand that the disease was there, but it does the damage in the body of the birds. So these are very important. And then parasitic diseases like coccidiosis, they are also immunosuppressant. There is one more parasite called as cryptosporidia, or cryptosporidiosis is the condition that is also immunosuppressant, but it's very, very rare. In all the 36 years, I have seen only one case when I was working PDRC with cryptosporidiosis. Now, IBD, if we think of, chicks which are infected early in the life with IBD virus have increased susceptibility for so many diseases. Because what happens is, when the chick is in young stage, its immune system is not fully developed, not fully functioning. It takes almost 3 weeks for its complete immune system or for the birds to become immunocompetent. So in that stage of development of immunity itself, if there is IBD attack, then these chicks, they will not die, but they will become susceptible for so many diseases in the later life. Like viral diseases, it is IBH, Murray's, IB, ILT, CAV. Bacterial, it is Salmonella, E. coli. Then in parasitic diseases like coccidiosis. So everywhere you see that the birds are becoming more and more susceptible because they were exposed to IBD virus at a very young age, wherein there may not be modulate at all. And in many cases, if we just improve IBD and CAV control programs by preventive measures like vaccination, some feed additives, some water medication, some biosecurity measures, if we improve on IBD and CAV control programs, we can solve so many problems of persistent diseases. I have done it when I was working in Navapur for a long time. I was not stationed at Navapur, but from PDRC I used to go to Navapur, and many problems we could solve after we could reschedule IBD vaccinations. That time CAV was not major, but that is very important that by controlling these two diseases, we can prevent a lot of further diseases which are coming at a later stage in the chick's life. So this is just for what we have been observing in IBD, just as a refresher. Muscular hemorrhages in the thigh muscles, of course, they are there in the breast muscles also. Then enlargement of bursa 3 to 4 times. And then when we open this bursa, all these mucosal folds will have a lot of hemorrhages and very much enlarged. So this we have seen, and even this type of dark red bursa, we have seen this is in situ and this is remote. This was in a broiler farm, I think around 32 days of age I visited. But fortunately, the mortality was just 0.2% here, and then the flock was liquidated. So this type of problems we can see in IBD. Then our second immunosuppressant, main important, is chicken anemia virus, which is a burning issue for last almost 10 years. Because it's only CAV itself is immunosuppressant, and when it is coming in association with other immunosuppressant agents, I have shown you a long list of immunosuppressant agents. So if CAV virus, chicken anemia virus, is coming with some other immunosuppressant agent, naturally the CAV infection becomes increasingly severe, and the losses are very huge because of so many other complications of CAV. Even CAV will suppress the immunity produced by HVT vaccine. So even if you have vaccinated birds with HVT and the birds have developed the immunity against it, against MD, but if CAV is there at the growing phase, then this immunity is complete failure and you will get mortality of VVMD at early stage. So that is importance of CAV, because CAV is underlying cause of so many problems which actually are seen at a later stage. CAV, what cases I have seen, is generally around 4 to 5 weeks of age in layers. And when the birds are about 8 to 9 weeks, we see the other problems like gangrenous dermatitis or other bacterial infections. So these two, as I said, IBD and CAV, they are the main immunosuppression diseases in all the poultry operations, which need to be controlled to further prevent further losses into the farms. Now these are few photographs you can see there. The extreme left slide, you can see that coiling layer of gizzard very easily removed. If you see a freshly dead bird, you need to put a lot of pressure to remove this coiling layer. And on the muscular layer, you see a a dry surface. But here in case of CAV, this layer can very easily be removed and the surface below is not dry, it's moist. So this is generally indication of CAV. Of course, in certain toxicities also you get it, but this is generally taken as first indication. Then if you open the long bones, the upper bone you see is a pale fatty bone marrow, whereas the lower bone is a normal bird, healthy bird, which is a dark bone marrow. So this is, since the name itself is anemia, we'll see the anemia everywhere. So here you see that the bone marrow has become very pale and fatty. Similarly, one more lesion which I have not taken the photograph here is the regression of thymus. Thymus, we know at particular age, you see the particular size. But if CAV affected chicks are there, you will see that they are practically not existent. They look like a just sesame or something. So that is one fact. And if you take the blood in the laboratory or even here, I don't know whether you can appreciate the colors. On the left side, what you see is a healthy bird. And on the right side, what you see is chicken anemia virus infected bird. The color on the left side is dark. Color on the right side is faint. And PCVPC packed volume, it is higher in normal bird, whereas it is very low, almost 1/4 in affected bird. So these are some findings of chicken anemia virus in field as well as in the laboratory. Of course, confirmation has to be done by virus isolation or PCR. That is very important. But as a first line of diagnosis at the field, we should think of chicken anemia if we see this type of pictures, and then we can start some measures. And then gangrenous dermatitis is also generally a sequel to CAV. Because in many cases, when there was history of chicken anemia virus infection at, they say, 4 weeks or 5 weeks, and the mortality, whatever it was, maybe 5%, 6%, 10% in layers. And then when these birds were about 8 to 10 weeks of age, they suffered from gangrenous dermatitis. And again, the mortality was something like 5-6% in many flocks. So this is underlying cause was actually chicken anemia virus, and the birds died of dermatitis. That's what I said. Unless we take precaution of these two conditions in growing phase, we will not be able to take control of other situation at the farm. Then one more, as we know, is Murek's disease. Of course, I won't go in details for the Murek's disease. We know everybody. I'm just showing some photographs because that is also an immunosuppression disease. These are not very common photographs. What I'm showing you. On the top of it, you are seeing the ocular form or the form which affects the eyes. The one on the left side eye is normal. The one on the right side eye is affected with Murek's. In cutaneous form, you see maize seed-like growth on the skin. So in many flocks, you will see it on the neck part. Sometimes you will see on the abdomen also. So these are cutaneous forms and ocular forms which are not very common. So I've shown the photographs. Then these, of course, we know the enlarged nerves, the sciatic plexus. If you see, it is enlarged. Then this is a typical posture: one leg ahead, one leg behind, stretched. Then sometimes enlarged liver, enlarged kidneys. Of course, here there could be confusion between avian leukosis complex and Murek's. The confirmation has to be done by histopathology. Grossly, it's practically impossible to differentiate between these two. And this is very common, very easily identifiable photo, that is nodular growth on the liver or other organs in the body. So this also again happens to be a disease of immunosuppressive nature. Then coccidiosis. We know that even in the cage brooding also we are getting coccidiosis. Even in laying phase we have seen the cases of coccidiosis. The birds are in the cages, they are in lay about 30-40 weeks. Again we have seen coccidiosis cases over there also. So we see that the upper two photos are cecal coccidiosis, lower two are intestinal coccidiosis. That again is immunosuppressive disease. Many times it so happens that we do treat birds with coccidiosis, we bring the mortality under control, but generally the surviving birds, they have lost their immunity to a certain extent, and that's why we may have to revaccinate with the same vaccines which were given earlier, because the titers are already going down. So coccidiosis, of course, any disease prevention is better than cure, but if at all it has occurred, again it's a immunosuppressive disease. And many times this also comes as subclinical disease. So we may not be able to identify that the disease was there. By chance, if we have opened the bird for some other reason and intestine is showing some inflammatory thing, we can confirm with either smear or histopathology. So that also happens to be an important factor in immunosuppression. Then after infection, of course, infectious bacteria are also there, like I said, Salmonella and E. coli, but more important are viral diseases. Then toxic factors. When I say toxic, as I said, it could be by mycotoxins or pesticides or microbial toxins or drugs. Mycotoxins, we all know there have been at least 8 mycotoxins which are seen now in the field. And earlier, about 15 years back, we were worried only of aflatoxin. And we thought that these mycotoxins will be produced only in the field, which is having high moisture and warmth. But nowadays, other toxins, zearalenone or citrulline, they can be produced at as low as 8 degrees centigrade, and they don't need any moisture also. So there have been mycotoxins which are seen around the year, and so around the year mycotoxin binders are necessary now. Earlier people used to put only new maize season. Now of course around the year we are using them. Microbial toxins, as I said, E. coli, Salmonella, Clostridia, they have their endotoxins, and they also cause immunosuppression because of their toxic effects. So naturally, our target is to prevent these bacteria from entering our poultry operations, or then not allowing them to take upper hand. Then pesticides, as I said, we have to go for so many pesticides in the agricultural field. So sometimes by mistake, nobody puts them purposely, but inadvertently, sometimes these pesticides may gain entry into our field operations, and then when the birds eat this type of feed, they may suffer from immunosuppression. Nowadays, a few new toxin binders have come in market. They claim to bind pesticides also. So we can go with them so that the risk of pesticide consumption goes down. Drugs, as I said, we may have to use at certain points to control the mortality or check the problem what we are facing in the flock. But sometimes it so happens that farmers use it indiscriminately. They don't ask our vets what should be the dose. Actually, every antibiotic has got prescribed dosage as a baseline, maybe 5 mg per kg, 10 mg, 50 mg, whatever it is. So that has to be followed, and then looking at the concentration of the active ingredient in the commercial product, the dose has to be calculated accordingly, and that vets can do it, but farmers many times do on their own. And even in vets, I'm sorry to say, but certain vets, they use the dose like so many grams for so many liters or so many ml for so many liters. That's not the correct way. We should go with the dose of antibiotics based only on the body weight, because water consumption drastically varies. When we are thinking of broilers in the summer season, the birds which are drinking 200 liters of water, in winter season they drink only 100 liters. So what is the correct dose? If you are going for 1 gram per liter, then 200 grams is the correct dose or 100 grams. So if we go with the body weight of the birds, see the active ingredient composition content, and then go with the correct dosage, that gives you correct thing. But what happens is, if I don't get the result with 10 mg per kg standard dose, I go with 20 mg, 30 mg, 40 mg, just go on increasing to see, and that's why such a big resistance of antibiotics, MDR, multi-drug resistant bacteria emerged. So that indiscriminate use is causing this immunosuppression, and certain drugs like sulfur drugs, now definitely they are very effective in controlling so many type of bacterial and coccidial problems, but they are potentially toxic if you give a very high dose or give for a long period. Now, many times if you see the sulfur drug recommendation through water, it is 3 to 5 days, but I've seen the people using it for 10-15 days also. So that type of thing is not actually good, because sulfur is going to definitely have adverse effects on our immune system. So either prolonged use or high dose. So that thing causes drug toxicity in the birds. Mycotoxins. Presence of low level of mycotoxins in poultry feed may result in poor performance because the dose is not so high or the content is not so high to kill the bird or produce some disease outbreak as such. The low levels, if they are there in the feed, even aflatoxin, they can lead to poor performance and decreased resistance, that is immunosuppression. Even though, so we say that certain levels are safe, some ppb, some ppm, but low levels also can cause poor performance and decreased resistance to the infectious diseases. Aflatoxin, if it is there, it will increase the susceptibility to cecal coccidiosis, Murray's disease, salmonellosis, IBD. So aflatoxin is still an issue for us. So it will cause a problem by increasing the susceptibility of birds to these diseases, that is, they are immunosuppressed. Then presence of low level of mycotoxins in feed can lead to disease occurrence even in properly vaccinated flocks. This is what I said in the markers of immunosuppression, either poor response to vaccination or total failure. Because I have seen so many times that the farmers, they definitely have a good vaccine from a good company. They store it nicely, they administer it nicely, but still, if they check the titers, they don't get the desired results. For example, ND titers. After good vaccination in layers, we can expect the GMT, geometric mean titer of 8 or 9, but you may get even 4 or 5 with good vaccination also. And sometimes, despite this vaccination, there is complete failure and a frank outbreak of the disease. So this clearly indicates that there was immunosuppression. Reasons, of course, we have to find out, go to the root cause and find out. And then public health concern is also there, because if you use feed containing mycotoxin, there will be a lot of diseases in the bird. For those diseases, we have to use antibiotics. Then those residues come in the human food chain and all those things start. So public health concern is also an important issue of mycotoxicosis. Then nutritional factors. As Dr. Ajay said in the beginning, nutritional factors play a very important role in entire performance of the bird. Leave aside immunity or immunosuppression. It has to be a very, because as we know, highest share of expenses for production of chicken egg or chick or meat is nutrition. So what are the causes over there? One is imbalance of nutrients. We always say that it has to be a balanced meal, balanced square meal or fair square feed. Now, what could be imbalances? Say nutrients, vitamins. Now, for say particular layer bird, if I want 15,000 units of vitamin A per kg and 3,000 units of vitamin D per kg, so there is a balance, 1:5 ratio we are maintaining there. But if I put 20,000 units of vitamin A and 3,000 units of vitamin D, that is not a balanced thing. So imbalance of nutrients, there is of course certain proportion of calcium to phosphorus and all those interactions are there. So those things need to be balanced. Imbalance will cause the problem. Minerals, macro minerals as well as micro minerals. Every mineral is important in developing immunity, in having vaccination titers. Amino acids, of course, again, very important thing. Nowadays, we are speaking of proteins for getting good immunity against COVID. So amino acids, of course, they are building blocks of proteins. So amino acids, now there are very good nutritionists in our platform. So they know which amino acids are essential, non-essential, what is the total sulfur containing amino acids, digestible levels, everybody knows. So all those things are very important as far as imbalance of nutrients is concerned. Second factor could be deficiency of nutrients. So your feed may be balanced, but deficiency of nutrients may be primary or may be secondary. Now primary, what is that? In the formulation itself, there may be some mistake. Because we know as per age and stage of production and season, we give different formulations to different birds. For broilers, of course, we have got pre-starter, starter, finisher 1, finisher 2, layers, brooding, starter feed, grower feed, pre-lay, layer 1, 2, 3, and breeders also. So there are specific norms of individual breed, and we must maintain that. If we do a wrong formulation, thereby giving less levels of that, then it's a deficiency. Your feed may be balanced, but all the levels are low. So there is a imbalance, and there is no formulation as per stage and age and stage of production or season. That is a primary deficiency. And secondary could be because of gut health issues. We always speak of gut health to get best results. Nowadays, so many companies are speaking of gut health, and so many products have come in market. But if gut health is not normal, naturally, whatever you give, it's a good thing, but birds are not able to assimilate it, not able to use it for their body functions or their immunity and production. So those things are also concerned with nutritional factors which are cause of immunosuppression. Now, whenever there is, of course, when we make feed, we put higher levels of vitamins and nutrients rather than just for maintenance, because we know that there are other needs also than maintenance and production. So especially when there are stressors of environmental and disease, then the requirements of essential nutrients drastically increases. And that's why if our feed is just enough to maintain, then at the time of disease and environment and those type of stresses, our nutrition is deficient. And so you get immunosuppression since we are not giving higher doses than what we require for maintenance. Now, as I said, immune system is developing in the young age of the birds. Up to 3 weeks, they are not immunocompetent. And in such stage, if there is deficiency of nutrients, it's detrimental to the developing immune system because it will not develop fully, because as it is at the development stage itself, it is suffering from lack of nutrients, so it will not give a good immune system to the birds. Now, especially required for immune system are linoleic acid, vitamin A, vitamin D, iron, selenium, and several other vitamins. Now, why vitamin D I have put in bold letters? Now, in humans also we are discussing about vitamin D. Now, whoever has got experience of COVID himself or family members or some known people, they know that vitamin D was given to all these patients. That 60,000 units of medicines are available, either powder or tablets or capsules. So everybody was asked to get vitamin D to increase the immunity. In birds also, it has a very high important role in immunity development. Nowadays, what happens is sometimes EC houses are there, and then sometimes these battery cages of 6, 7, 8 floors, even open houses, I say, battery houses, the middle rows, they will not get enough sunlight. So they will not get that sunshine vitamin D, which is naturally developed. And that's why in such cases, we must add extra vitamin D than what is recommended for the breed, for the age, for the stage of production, so that they can compensate for loss of sunlight, what they are not having. So vitamin D happens to be a very important vitamin for nutrition, immunocompetence in the bird. Environmental factors, as I said, there are 3 main important things. Extremes of temperature. Now, you know that sometimes the temperatures in certain poultry beds go up to 50 degrees Celsius, and northern belt in the winter they go up to 2 degrees Celsius. So such extremes of temperature, birds cannot sustain. They will definitely lose their potency to fight the diseases. Then sudden change of climate. If slowly the temperature increases or decreases, birds can definitely adapt to these changes. But today it is 30 degrees and tomorrow it is 35 degrees. Bird cannot adapt. Or today it was 20, tomorrow it is 15. They cannot adapt. Sudden change in climate is again an immunosuppression factor. And then incessant rains, non-stopping rains. Now, in certain periods, of course, we have seen last 8-10 days what havoc the rain has played in our Maharashtra state and many northern states also. But when there is continuous rains, the side curtains cannot be opened. And then there will be a lot of humidity inside, ammonia inside, and all these will lead to immunosuppression of the birds. So environmental factors are also there. And that's what I said, when the environmental factors are putting stress, plus some infection stress is also there, the requirement of nutrients increases drastically. If they are not made of, then the bird will suffer from immunosuppression. Then in the managemental factors, stress is the most important factor causing the immunosuppression. There is no substitute for good management. This sentence is written in so many books. That's why I put it in bold and red letters. There is no substitute for good management. You may be having good breed, good feed, good construction, but management has to be good on all the aspects, because management itself is a very big issue. Stress, one of the most common causes of immunosuppression in poultry. Now, stress, I told you, because it can be any stress, maybe because of not getting the feed, maybe because of poor ventilation, maybe because of shortage of water, maybe because of so many things. Overcrowding. Overcrowding is definitely a cause of immunosuppression. I will tell you I'll share you one experience with you. This is pretty old, in 1997, when I used to visit Hyderabad area with Dr. R.K. Phatak. IBD outbreaks were abundant that time. Tremendous IBD outbreaks in practically all the layer belt. In Hyderabad, you know, it is a big layer belt. That time, the flocks used to be about 10,000 birds. Now, nobody is having such a small flock in Hyderabad. But that time, the flock size was average 10,000 birds. Brooding was in cages. And whenever IBD outbreak struck the farm, it would be something like 20% mortality in the flocks. So somebody had a very good idea from his fertile brain, and he said, let us put 20% extra chicks, so that even if we lose 20%, we'll have our original number. So in place of 10,000, they put 12,000 in the same cages, and when the outbreak struck, they lost 30% instead of 20%. So that is very clear indication overcrowding will always cause immunosuppression in the birds. Poor ventilation, which leads to ammonia built up in the shed. We know ammonia is highly detrimental to trachea, because in most of the birds, in our chicken, the ventilation is very important, because we want the respiratory system to be protected, because many pathogens enter from respiratory tract. When the trachea is damaged, because there is always some mucus in the trachea, which is normal thing, and mucus has got some water in it. When ammonia is coming, NH3, so NH3 plus H2O, NH4H, sodium ammonium hydroxide, that is a highly irritant substance, which will cause damage to the cilia or ciliostasis, which paves way for organisms to enter into the deeper respiratory tract. So poor ventilation is again an issue of immunosuppression. Faulty brooding conditions. Brooding is a foundation of further performance of the bird, we know. And there are so many things as far as space is concerned: number of feeders, number of drinkers, or feeding space, drinking space, then vaccination, handling of the birds, shifting of the birds. So many things are there in brooding conditions. If there are faults in that, then the birds will not have good immunity. Improper handling of birds. Then when we are handling the birds for vaccination, or weighing, for thinning, for shifting, if you not handle them properly, roughly, it will cause the problem. Faulty vaccination, putting undue stress on the birds, especially if you are giving in the neck or wings or intramuscular, lot of stress will cause that thing. And faulty storage of feed. I'll show you some photographs in broiler sheds. Because the feed, even if you get a very good gold quality feed from the feed mill, if your storage is not good, definitely there will be some formation of mycotoxins, and when the birds consume it, you will get the problems. There may be even bacterial growth also. See, this type of feed storage is absolutely wrong. Whenever we say how to store the feed, it should not touch the ground, it should not touch the wall. It should be at least 6 inches away from the ground or floor and 6 inches away from the wall. Why? Because it has to have good ventilation around it, so that there won't be any development of fungus or bacteria. When you're putting it like this, and if there is percolation of water through wall or through from floor, even these bags look like plastic, they are not waterproof. Water can enter in it. And then, even if it is a good feed, some mycotoxins, some fungus will grow, some bacteria will grow, mycotoxins will be produced. And when the bird eats it, you will get the problem. So, wrong storage of feed is also a cause of immunosuppression. So, we expect this type of feed storage, wherein maximum 6 bags can be stacked one over other, not like 7, 8. And all-round ventilation is there. So, this type of storage we expect. If there is a small farmer, sometimes he says, I cannot spend this much. They can go with some simple tricks like this, wherein they can store their feed so that it doesn't develop any fungus or bacteria while in the storage. Then these are again some managemental flaws. See the bad litter condition, looking like complete wet litter. And here on the right side, what you see is cake formation in the feeder. Now, when this happens, actually, when the birds are very young, especially in broilers, we expect them to feed at least 4 or 5 times a day. But many times they just feed the feed in the bucket and lift the bucket slightly so that the feed comes in the trays. That is wrong. Many times the water falls inside and this type of cakes are formed. Now you can expect a lot of fungus in this, lot of mycotoxins. So this is again a managemental flaw. Then debeaking also. If you this type of debeaking, birds will have loss of immunity. Now all the birds are from the same flock. They are not from younger and older flock. The top left, if you see, even the nostrils are also cut there. And it looks like just 15-week bird or so, because it's wattle and comb, nothing is grown, neither dark red, nothing. So this is wrong. This is slightly better. The second one, right top, again not good, because you see the growth of this comb and wattle, not good. And this is the best. Correct, right is this. Actually, these all birds are of same flock, 24-week flock from a layer flock. but see the debeaking fault. Now the bird doesn't come and say कि हमारा beak इतना काटो. We are cutting the beaks. So this thing is very important. Looking at the stress on the birds. And then the biosecurity, of course, it's a most important part of management. Failure to implement a good biosecurity program is the main cause of immunosuppression. Even many times we say that whenever is a disease at the farm, it indicates that there is a breach in the biosecurity protocol. So biosecurity has to be in place and has to be implemented, because many times on paper we have a very good biosecurity program, but it is a bit difficult to implement because the persons who have to implement it, they don't understand the importance. So it has to be designed in such a way that the lowest person also can understand what is his role in this. So that has to be implemented. It's a necessary expense and can make difference between failure and success of a poultry operation. Actually, I won't say an expense. I use the word expense, but it's an investment. It's not an expense. You will definitely get a good return on investment. Why we invest? We want to have some good return. If we spend 1 rupee, we expect at least 1 rupee to come back or more than that. So it's not an expense really, or necessarily expense you can say. And it's an investment which will give you high yield after the birds are growing up. So if the biosecurity program is scientifically designed, it is rigidly followed at the farm, and if the birds are vaccinated against the common diseases prevalent in the area, the chances of developing immunosuppression are very low. Of course, the other factors, what I said, the environment and feed and all those are there. But these, as I said, are important factors. So if the vaccination, we are going to come in the next slide, is done against all the prevalent diseases as per the schedule, and biosecurity is placed, generally they will get good results. Rodents, I showed one portal of entry as rodents also. So this is not an empty shed actually. This is last 10% of the shed. The birds, because of mortality, they keep on shifting birds to the front side. So last 10% birds are cages are vacant. You can see the bird, rodent. The rat is sitting on the egg. Now, when you see one rat in the daytime in the shed, there are 100 hidden rats. That is the calculation. So you can imagine. And again, rats, as you know, 3 types of losses we incur. One is they eat a lot of feed. Second is they damage the wirings and bags and everything. And third is they bring so many infections in the shed. So rodents, of course, they are also part of biosecurity. We must see that they are not there. Now, what are the possible damages because of immunosuppression in poultry? One is birds mortality. As I said, more than normal mortality. Drop in egg production, we know there is a consistent graph of egg production. There will be drop in egg production or no consistency in egg production. Deteriorated internal and external quality of eggs. So those who are layer farmers or breeder farmers, they know that eggs are having internal and external quality that may be damaged. Reduced hatchability, your breeder birds may be good, egg percentage may be good, but hatchability won't be good. Poor quality of chicks, no consistency in egg production, ups and downs like ECG. Then slow growth rate, as we said in the markers, and then poor FCR. So all these are possible damages in poultry because of immunosuppression. Now, this has nothing to do with immunosuppression. This is a photograph in Sydney. I had been there about 8-9 years back, and that library letters are written very finely. So I just placed it so that you will also enjoy that later. Now we know what is immunosuppression, how to prevent it, because prevention is always better than cure, we have always said. So proper cleaning and disinfection of poultry houses between the flocks, most important step, because once your flock is removed, there will be a lot of bacteria or viruses or fungi or parasites in the shed. Now, many times it so happens that after the birds are removed, maybe birds are sold as broilers or maybe birds are removed from brooding shed to growing shed. People feel that there was no outbreak in my shed, so I need not do very thorough cleaning or disinfection, but that is wrong. Because certain infections, if they affect the chicks, there will be disease. But when the birds are grown up to 6-7 weeks, the same bacteria, same infection doesn't cause disease. So it doesn't mean that there was no infection. There was infection in the shed. So once the flock is removed, very thorough cleaning and disinfection is very must. And out of that, cleaning is very important, because unless you do very thorough cleaning, the disinfectants don't work. So cleaning, if you don't see any dust or dirt or cobwebs or any feathers or blood spots, anything with naked eye, that is a very clean thing, and that removes almost 80% of pathogens from the shed. And then your disinfection is very powerful. So the terminal infection and as well as continuous disinfection in the presence of birds will definitely reduce the bioburden and the immune suppression chances are less. Sufficient rest to the shed before placing new batch of chicks. Now rest is very important word over there because many times people keep the shed vacant but cleaning is not done immediately. That is not the rest. When I was working in Sangli, when I started my career in 85, there was a belt called Vita and the replacements were not very fast for layers. Once the chicks were shifted from brooding to growing, the new batch would come after 2.5 to 3 months. So they will clean the shed only 15 days before the chick arrival date. And then they will say, I have given 3 months rest to my shed. That is not. Once you do disinfection and cleaning, whatever period is empty, then that is rest. So sufficient rest before placing the new batch. Biosecurity, as I said, important. Scientific formulation of feed according to age, season, and stage of production. Use of good quality toxin binders in feed around the year. Why I say good quality? Because you know the toxin binders could be available from 20 rupees a kg to 300 rupees a kg. You have to decide which is good one and see that it binds only toxins and not the nutrients. So good quality toxin binders. Required amounts of vitamin D, A, E, and selenium, which are again very important in immunity development. Good quality drinking water sanitizer in proper dose and with proper method. Why I said proper dose is because companies recommend certain dose, like 1 ml for 10 liters or 1 tablet for 500 liters. But if our bacterial contamination in water is very high, like in laboratory, we do MPN test, most probable number. So we can go highest up to 1800. 1800 plus is our last result. So if we are having 1800 plus, that dose of 1 ml for 10 liters may not work. We may have to go to 2 ml per 10 liters. So proper dose, proper method, water sanitization is very important. Maybe iodine, maybe hydrogen peroxide, maybe chlorine, anything. Then correct methods of management to minimize the stress on birds, because stress is a very important cause of immunosuppression. So to reduce the stress, we have to see the management which doesn't put any stress on the birds. Adopting preventive steps, anticipating forthcoming stress like vaccination, debeaking, shifting, grading. Now these stresses we know, and we know when these stresses are going to come because we have planned that frog will be vaccinated on this date, debeaking on this date, shifting on this date. So before that, we have to start anti-stress preparations, maybe herbal, maybe vitamins or anything. Anti-stress preparations, if I am to do debeaking on 10th, if I start this from 7th itself, they won't put a lot of stress on the birds. Like if I want to go on a long tour of 5-6 days, I start taking B complex and vitamin E before starting my tour. So that type of anticipatory measures, if we take, that stress we can definitely reduce. And then the use of immunomodulators. Now, what are immunomodulators? They could be immunostimulants or immunosuppressants. Immunosuppressants are also there, but we are not going for immunosuppressants, which are used whenever organ transfer is done in the humans. They don't want immunity, otherwise the organ is rejected. So we will go for immunostimulators. So keep the gut healthy by minimizing the use of AGPs. Antibiotic growth promoters, people are going less and less for that. And slowly the ban is going to come on that also. So keep the gut healthy by reducing the use of that. Immunomodulators, what are they? They are the agents which specifically modulate immune system, regulating immunity and disease resistance. So immunomodulators, lot of immunomodulators are there in the field with different preparations. Those can be used maybe through water, maybe through feed. So I've given the list: probiotics, prebiotics, essential oils, polyherbal preparations, aspirin, betaine, acetic acid, beta-glucans, seratio-peptidase. Then phytochemicals. Nowadays we speak a lot of phytochemicals. So phytochemicals like carvacrol, cinnamaldehyde, curcumin, thymol, these are also immunomodulators. So we should use some immunomodulators, maybe continuously in the feed or maybe at the time of stress, anticipated stress, we can use through feed, through water, so that you definitely get good immunity. And then most important is preventive vaccination against all the viral and bacterial diseases prevalent in the area. Here important thing is the designing of the vaccination schedule. So the role of we vets comes over there. We must study the history of the farm, study the history of the surrounding farms, and then we should design the specific tailor-made vaccination schedule for this farm. That they have to follow rigidly. That is a real good vaccination schedule. There is no substitute for good management. That is again coming, vaccination is not good management alone. Vaccine is not a silver bullet. It should be used as a part of good management and not as a replacement of good management. So vaccination is a must. And in the vaccination, there are 3 partners in successful vaccination. Only vaccine is not there. So what are this? One is chicken. Now what is meant with chicken is health. If you see brochure of any vaccine, they will always say vaccinate only healthy chicken. So health is important. Sick chicks won't mount good immune response. And immunocompetence. Birds should not be immunodepressed, immunosuppressed. They should be immunocompetent. Their immune system should be geared up nicely. Then vaccine. Depending on the age and the schedule, the vaccine will come, whether it is killed vaccine or live vaccine, then whether it is hot strain or mild strain, all those things depending on the schedule and their storage, whether they have maintained the cold chain or not. Then administration. That is again very important. I won't take long time because that itself is a big topic. Another 5 minutes I take. So administration, whether it is going as an individual bird, either eye drop or injectable or nasal drop, or mass vaccination, maybe spray or maybe drinking water. Lot of potential mistakes are there. If those are not done, then it's okay. So when chicken, vaccine and administration come together, you get what is we expect immunity. So those are very important things as far as vaccination is concerned. So my last slide, what is the take-home message? Immunosuppression can be prevented or its effects can be minimized only if all the factors like management, nutrition, biosecurity and good vaccination schedule go hand in hand in good harmony. So only one factor is not working. All the factors should go hand in hand in good harmony. Then if we suspect immunosuppressive conditions, the problem must be attacked from different directions. Multi-pronged approach we need. We cannot go only with one direction. Multi-pronged approach has to be there, whether it is coming as a toxicity or stress or infection or what. So multi-pronged approach we have to do so that the problem can be quickly corrected and further deterioration of immune system can be prevented. So prevention is of course must. So there are still many things to learn as well as a long way to go to completely understand immunosuppression because every day we are facing your challenges. So thanks a lot for your kind attention. Over to you, Dr. Ajay. Thank you.
Thank you very much, Dr. Rukadikar sir, for nice presentation. And I think you have covered all the factors that affect the immunity and health of the bird. It is said that problem begets the problems. For example, as you rightly said, deficiencies cause immunosuppression. Likewise, immunosuppression creates deficiencies. So once you are into the trap, it is very difficult to get out of it. And the time you get out of it, the damage has already been done. So your insights will be helpful to the young budding veterinarians and entrepreneurs too. For example, I am saying if subclinical coccidiosis is there because of improper coccidiosis program, which affects your gut health, and there is loss of endogenous amino acids. And what type of feed, whether you are giving dense feed also, so that is not being digested and absorbed properly, and you will be incurring more and more losses. Though the feed is dense, you will get the poor performance. Thanks, Dr. Rukadikar sir, for nice presentations.